Hi there, my name is Jenna Finfrock and I'm a member of Baggett's Board of Directors. Tune in as we listen to Dr. Rodgers Wilson. He's the Arizona Market Medical Executive and Senior Medical Director at Cigna. Please join us as we hear from him as he discusses how to maintain resilience in your life. And I don't know about you, but 2020 has taught us a lot of things, including the importance of resilience. And I hope you'll be able to join us for this important message. Thank you and have a great day.
Hi, I'm an administrative and forensic psychiatrist, and I'm happy to be with Baggett today.
Okay, Dr. Wilson will be discussing how to maintain resilience, a topic I'm sure will benefit many of us. So let's begin. Welcome to Dr. Rodgers Wilson.
Hi, hope your day is going well. I'm happy to be with Baggett today. Our topic is resiliency in the pandemic. During the pandemic, over 50% of Americans are reporting that their mental health is being affected by COVID, based on a Kaiser study. And 75% of Americans report social and financial impacts related to COVID, based on a recent study. We've seen an increase in post-traumatic stress disorder, depression, anxiety, and unfortunately, increasing suicidal ideations. Resilience is key in order to manage during this time in our history. Today, we are at home, we're wearing masks, we're socially distanced, we're using a lot of Wi-Fi. Interactions with friends and family has been reduced secondary to the coronavirus. This is the time to talk more about resilience. Psychiatry is evolving from a traditional model to a model that's focusing now on wellness versus disease, neuroplasticity versus neuropathology, positive factors versus risk factors, and psychosocial behavioral models versus medication-only models. Resilience is being promoted as an element of health. Resilience focuses on self-care and self-development. So, what is resilience? The APA defines resilience as a process of adapting well in the face of adversity, trauma, tragedy, threats, or other significant stressors, such as family problems, relationship problems, serious health problems, workplace problems, financial stressors. A more simplistic definition is, it's our ability to bounce back. Developing resilience reduces stress, which reduces the inflammatory process that negatively affects our body. Sleep, mindfulness, and exercise have anti-inflammatory effects. These are key elements in wellness, along with good nutrition and connectiveness. There are three key blocks of resilience as outlined by the American Psychiatric Association. Number one, secure attachments. So think about your relationships with friends, with family members. How do you enhance your relationship with your spouse or with your partner? Number two, purpose in life. What are your goals? Are you proactive in planning your life or your future? Are you proactive versus reactive? Number three, positive emotions are key. It's good to laugh. It's okay to daydream. Sometimes it's okay to be a 10-year-old. It's all about self-care. Being resilient doesn't mean a person won't experience difficulty or distress. People who have suffered major adversity or trauma or medical conditions can become resilient. While certain factors might make some individuals more resilient than others, resilience isn't necessarily a personality trait that only some people possess. So what do we know about resilience? It reduces depression, it reduces anxiety, it reduces inflammatory processes, excessive inflammation can affect your brain and vital organs. We know that it improves wellness, and it's our desire to reduce illness and to promote health. So how do we build resilience? Prioritize relationships. So you want to connect with empathic and understanding people who remind you that you are not alone. Join a group. Along with one-on-one relationships, some people find that being active in civic groups, faith-based communities, or other local organizations can provide you support. Take care of your body. Good nutrition, ample sleep, hydration, and regular exercise can strengthen your body's ability to adapt to stress. Avoid negative outlets. It may be attempting to mask your pain with alcohol, drugs, or other substances. Focus on stress management rather than seeking to eliminate the feelings of stress altogether. Help others. I can't overstate the need to volunteer in your community, to help out neighbors. I'll give you one example. My neighbor makes masks. So since the pandemic started, she's been outreaching to different neighbors. And she dropped a packet of masks at my door. I'm sure it made her feel good, but this was useful and it made me feel good. Be proactive. Ask yourself, what can I do about a particular problem in my life? If you're dealing with a medical illness, be proactive. Have a list of questions for your medical provider. Question your plan. Ask questions. Move toward goals. Ask yourself, what's the one thing I know I can accomplish today? For me, it's hitting the treadmill every morning. Look for opportunities for self-discovery. Going through a major medical condition such as cancer and accident can increase personal self-discovery. As a person who went through 2 cancers in 3 years, I had to readjust my goals. I explored goals that I had previously set aside. It was an opportunity for me to rediscover goals that I had forgotten. My cancer triggered my exploration into the arts. For me, it was about rediscovery. You can develop resilience to keeping things in perspective. One bad event in your life doesn't mean that the rest of your life is doomed. Accept change. Make alternate plans. Modify your goals when necessary. Maintain a hopeful outlook. Try to visualize what you want rather than worrying about what you fear. Learn from your past. What worked previously for you? What was useful for you in the past? Draw on those experiences. Seek medical help and services when needed. To conclude, resilience requires practice from a mind and body standpoint. This is an opportunity to increase your ability to promote your own wellness. Thank you for your time today. Now let's take a few questions.
Are there specific actions people can take to survive the pandemic and increase their resilience?
Absolutely. I think one thing we have been noticing is that people are on information overload. So sometimes you have to turn off the pandemic. I know myself personally, I've limited my contact with media, with reading newspapers, because it increases your anxiety. Again, you want to follow CDC guidelines, make sure you're wearing a mask, socially distant. And again, take appropriate precautions, but at the same time, just because we are physically distant, it doesn't mean that we need to be socially disconnected. I think one thing I try to do on the weekend, Saturday and Sunday, I try to Zoom a family member or a friend. So I'm asking myself, how do I maintain connections to people that I care about during a time when it's not healthy for me to be exposing myself to them? And I think you also have to be aware of the whole idea of meditation. Now, we know anxiety has really increased during the pandemic. What do you do to reduce your anxiety? Is it exercise? Is it journaling? Is it just doing nothing? And I think we're all under a level of stress now. And we have to be careful not to self-medicate, again, with alcohol or food, but really work on a plan to take care of yourself. The pandemic is real. It's placing us at risk physically, but it's also placing us at risk emotionally. Again, think about people who struggle with being alone. We do know some of our younger members of our society are really struggling with loneliness. And so compacting that existed prior to the pandemic, they are at risk for depression, increasing anxiety, and substance abuse. But I think it's all about self-care and really minimizing your contact to too much exposure to media. Is there another question?
Yes, what are some of the mental health consequences of the pandemic, and what kind of conditions are we seeing?
We're seeing a lot of depression. And one thing I notice is that we're seeing increased prescribing of antidepressants. We're seeing increasing prescribing of anti-anxiety drugs. And this is concerning because there's more self-medication. So depression and anxiety are key. We're also seeing post-traumatic stress disorders and also acute stress disorders. So imagine coming down with the COVID virus. And if you're lucky enough to survive, you also may have periods of traumatic memories related to being ill. Think about individuals who have lost family members secondary to the coronavirus. I personally have lost 2 first cousins to the coronavirus in my home state. I couldn't go to their funeral. I had to do a virtual funeral. These are real things that's really impacting all of us. We also know that substance abuse has been a big issue. So think about people in recovery for substance abuse. A lot of the treatment has been based on self-help, going to AA meetings or NA meetings. Now they're doing some of that virtually, but they've lost that human contact, which really places them at risk for relapse. So we're seeing a lot of mental health consequence as we look at the pandemic. The major concern, of course, is suicidal ideations. I was unfortunately talking to a provider recently, and he was seeing more patients, and this is a primary care provider in an internal medicine clinic. He's seeing more of his patients thinking about suicide. So he's linking them to behavioral health services. But this is impacting us not only as a community, but as a country and as a civilization.
Dr. Wilson, I have a question for you. For those of our listeners that are going through cancer treatment or diagnosis right now during COVID, can they still be resilient, and how can they do that?
They can. Understanding that we've also seen people with cancer diagnosis, which we don't want to see, they're delaying treatment and evaluation secondary to the coronavirus. So they also have a concern about going to see a doctor because they might be exposed. We're also seeing people concerned about going to a doctor because they think the doctor's too busy taking care of coronavirus patients to take care of them. I think resiliency is really related to self-advocacy. Bring in family members, bring in significant others into your care. Think about putting proactive plans in place. Review your treatment plan with your provider. Make sure you're looking at your own preference as it relates to treatment. Do second opinions. Just don't get one opinion when you have a cancer diagnosis. Get several. I know when I went through this personally, I saw 3 doctors. I wanted to see what each doctor was proposing for treatment. But you really want to take charge of your illness and manage your illness. You want to read, you want to look at literature, you want to reach out to Bagot, but bring all these resources in so that you feel in control of your condition. One thing I advocate too for people who are going through cancer treatment, think about some of the side effects, for example, that we get from oncology drugs. Learn from that. We call them modifiable conditions. So if you get headaches, if you become nauseated, if you become dehydrated, talk to your provider about pre-treatment. So if I'm going to get a headache, what can I do prior to treatment? If I know I'm becoming dehydrated, can I actually get an IV prior to going through that treatment? It's about being proactive. It's about your health. Be an active participant in your health.
Thank you so much, Dr. Wilson. This has been great. And I was wondering if the lack of wellness or resilience can that exacerbate any pre-existing conditions that we have during this time?
Absolutely. So, one thing I think about is diabetes. Again, it's a high prevalent condition in our community. But think about if you're stressed, you're dealing with the pandemic, you're dealing with what comes with the pandemic, you're going to increase particular stress hormones in your system. So think of cortisol. So the increase in stress increases cortisol. As a result of that, that level of stress makes your diabetes more difficult to manage. Your blood glucose may bounce all over the place because you're under stress. Think about individuals with chronic conditions such as COPD, with asthma. We do know that stress reduces your immune response. So if you have a respiratory illness, you're more likely to get infections because you're less apt to fight those infections off. So managing your ability to be resilient is key to managing those chronic medical conditions. You can't separate the mind from the body. They're connected. Other questions? If not, thank you for your time today. It's been a pleasure.
Dr. Wilson, thank you from all of us at Bagot. We know your time is very valuable and we appreciate your willingness to give up some of that and share your wealth of information with us here. So thank you again, and we really appreciate you stopping by today.
My pleasure.
Don't forget about the other ways that you can support Bagot's Get Moving fundraiser. We have the Gift a Bag, the Get Moving raffle, or any donation to help us meet our matching grant. As always, we appreciate your support. Join us tomorrow and hear from 10-year-old spunky survivor Zach and his mom Beth.